Well, we have overhyped this in the past. We are guilty of overhyping this in the past, of just remote patient monitoring, hospital at home. We got out over our skis and said it was going to be there. But now what you have is, it feels to me like a race for the home. Like, more services, more things going on. And it's being led by, it really is being led by whoever's taking risk, right? So you mentioned Humana is going after that. And there are health systems that have risk-based contracts, and they'll do this because it is a lower cost of care to do it out of the home than it is to do it in the facility. And so if you get good at this, you can actually drive some costs out of the system and still get reimbursed at rates that make sense. There's a lot of they talk about the tailwinds. Patient habits changed during COVID. Physician habits changed during COVID. EMR integration is way down the road for a lot of health systems. I realize I shouldn't speak so broadly there. There's still some health systems that are implementing their EMRs and whatnot, but workflows are there. Reimbursement is starting to catch up. And then the technology is there, right? So we didn't even hit on the fact that, my gosh, you can't open social media or something without seeing an announcement of some new device that somebody's funding, and we saw the Livongo deal and how much they were able to sell for and whatnot. So there's a race of money, minds, and talent running after the technology to really perfect this. And then you're starting to see some things sort of coalesce around this, not the least of which is, this is one of the areas that competitors see as the opportunity to get in between, right? If I can go right into the home, either through televisits or physical visits, and then direct the care, I've now, again, disintermediated the health system.
Yeah, and this goes back to our earlier part of our conversation. If you don't take action, and I know there's always that sort of fear or governor that we don't want to get too far out ahead, but if we don't do something and take some risks, we are going to stop one day and look and say, where are our patients? We're going to keep, what we're going to keep doing is budget cuts. Yeah, we're going to keep, take another 10% out, take another 20% out. Why? Because the volumes are way down, revenue is way down, because the care is now being done by the payers. It's now being done by retail. And the other category, there's a bunch of other categories, but the other category is digital first companies, digital only companies that do some of these things, and concierge medicine. And pretty soon there's not going to be anything left. So that's why even if it's an experiment or a demonstration project, as CMS would call it, I would get something going in my health system and start working it and seeing what happens, because otherwise you're going to be caught flat-footed.